converted to an enormous makeshift hospital, part of Wuhan's response to the flood of new infections. Chinese state television broadcast footage of recently completed hospitals with multitudes of doctors taking care of few patients. But secretly recorded videos from hospitals paint a very different picture. Body bags containing the dead lying close to patients, even in waiting areas. This citizen journalist visited 4 hospitals in Wuhan.
People are not being informed about the real situation. State TV doesn't go where it hurts, but I think this needs to be seen.
The journalist found more body bags outside one hospital. Inside, he saw dying patients together in one room. He posted his videos online. Officials had him arrested, then released him after a public outcry. But in China, his online videos have been deleted.
Now, a cruise ship carrying people who may be infected by the deadly coronavirus has returned to Hong Kong after being denied entry to Taiwan. Health officials say that 30 members of the crew are showing symptoms.
The world dream has returned to Hong Kong, though it remains unclear whether passengers will be allowed to disembark. Coronavirus symptoms can take 2 weeks to surface, meaning suspected carriers must remain in quarantine for at least that long to prevent further transmission. Health officials have begun testing the passengers and crew on board, with confirmed cases already being sent to hospitals. The ship's arrival came as Hong Kong health workers began a 3rd day of strikes in the city. They want a meeting with Hong Kong Chief Executive Carrie Lam to discuss officially closing the border with mainland China, a move they believe would halt the spread of the coronavirus that has infiltrated Hong Kong and already killed 1 man.
We urge her to solve this situation by coming out to reach us and talk to us.
The World Health Organization has declared the virus a global emergency, but not a pandemic. In other words, it might be spreading, but don't panic.
Currently, we are not in a pandemic. We are at the phase where it's an epidemic with multiple foci, and we will try to extinguish the transmission in each of these foci.
China was praised this week by the WHO for its reaction to the outbreak, with the virus relatively well contained until now. Its arrival in Hong Kong represents a new challenge. This government must now also prove it is equal to the task of dealing with it.
And for more, we go to Charlotte Chelson-Pill, our correspondent in Hong Kong, who is at the harbor there. And Charlotte,
from the epicenter of China's coronavirus outbreak are coming home to the U.S. this morning. One plane landed just north of San Francisco only minutes ago. A second plane is expected soon. And another American is one of 10 passengers on a cruise ship in Japan who tested positive for the virus. The overall death toll is approaching 500, with more than 24,000 people infected overall. Ramy Inocencio is in Beijing for us. Ramy, good morning. What about those Americans in China?
Good morning. Yeah, we now know more than 500 Americans have been evacuated out of Wuhan, but time is running out for any U.S. citizens still there. That's because the State Department has confirmed that they are now planning no more flights after tomorrow.
Desperate to get home, around 350 U.S. citizens boarded 2 planes last night to escape Wuhan, the center of the coronavirus epidemic. Priscilla Dickey and her daughter, Hermione, were among all those evacuated.
Get through everything. Now we just wait on a plane. Hermione's so excited.
They were screened for symptoms before boarding, but will still be kept in quarantine for up to 14 days in California. What they're leaving behind is a life on lockdown, where social media posts show the tough measures some Chinese authorities are taking. This woman is said to have been arrested in a grocery store for refusing to wear a mask. In another case, a woman gets into a fight after purportedly refusing to have her temperature taken. Other videos claim to show authorities dragging people away after they've shown symptoms of the coronavirus. Beijing has mobilized more than 7,000 tons of supplies for people in Wuhan, with the army laying out thousands of empty beds for more patients. But infections in the epicenter are spreading rapidly.
Experts have said that this epidemic could turn into a pandemic. How close are we to that?
We're very close.
Dr. Ian Lipkin is advising Chinese officials. He did similar for the SARS crisis here and says Beijing's approach has changed.
There's a very different sort of sense here than there was in 2003. Everyone realizes that the world is interconnected. We all have to do the best that we can.
And in Hong Kong, the city has now confirmed its first death from the coronavirus. That is just the second outside of mainland China after the Philippines. And take a look at this really compelling drone video out of Hong Kong. You can see so many people standing in line by the thousands just to buy a mask to protect themselves. We've just got a few here in Beijing, but I can tell you across China, across Asia, and across America, it's really difficult to find these. A very hot commodity. Anthony.
Well, all right. Remy Inocencio in Beijing. Thanks, Remy.
Begin with promising news for hundreds of Canadians stranded at the center of China's coronavirus outbreak. The federal government says it's making progress on an evacuation plan, and it's working to make sure families aren't separated. A number of other countries, including Germany, the U.S., and the U.K., have already airlifted citizens out of the outbreak zone. When Canadians will be airlifted remains unclear. Our government says it's still waiting for Chinese approval. Meanwhile, the novel coronavirus outbreak continues to spread. The number of cases continues to soar tonight, with more than 20,000 reported around the world. The death toll is also rising. It's now at 426. In our top story tonight, Mike LeCouture reports on the growing concerns among Canadians in the outbreak zone.
But please hurry and please don't split up families.
An emotional plea from a stranded mother. Megan Millward is trying to get home to Montreal with her husband and 2 kids. She and the children are Canadian citizens, so they should be guaranteed seats on an evacuation flight. But it's unclear if her husband, who has permanent resident status, will be left behind in Hubei, China.
I mean, I don't know what I'm going to do on my own with 2 kids in quarantine for 14 days.
At a media briefing, Foreign Affairs Minister François-Philippe Champagne tried to reassure stranded Canadians that families wouldn't be split up.
We have asked the Chinese authority to allow the primary caregivers, whether they're Canadian citizen, permanent resident, or Chinese national, to be able to fly with that child in Canada. We receive assurance that China will follow suit on that.
So if Millward's husband isn't considered the primary caregiver, will they split up the family? Well, that is still unclear. We do know the government has a plane and a plan for the more than 300 Canadians who want to come back. It will be pre-positioned in Vietnam while waiting for China to give the green light to land in Wuhan.
We're working hard with Chinese authorities in terms of bringing people home as quickly as we can. We understand there are many steps, both health and safety steps that have to be gone through.
One of those steps is the Chinese approval of the flight manifest list, so those Canadians will be allowed through police checkpoints in the city, which is under a lockdown. Once back in Canada, they'll be quarantined for 14 days at CFB Trenton in Ontario. Passengers will be isolated from residents of the base and each other.
So if one person falls ill, that won't necessitate the start of another quarantine for all of the passengers.
For now, the Canadian government is telling people to avoid non-essential travel to China, but the Canadian military issued a travel ban. In an order to Canadian Forces members on Monday, the country's top soldier, General Jonathan Vance, told soldiers to cancel.
Thank you for joining us today. My name is Dr. Henry Walk, and I'm heading up the local team from the Centers for Disease Control and Prevention. We are responsible for helping to ensure the health and well-being of the people the Department of State is returning from Wuhan, China, as well as continuing to ensure infection control and other precautions are followed. The evacuees will be temporarily staying at Travis Air Force Base during the remainder of their 14-day quarantine. I'm happy to report their plane touched down safely earlier this morning. There are a total of 178 people on this flight, and they're glad to be here. They've been through a lot, and we're going to do everything possible to care for them. Because these people lived in Wuhan, the epicenter of this outbreak, where there was intense and escalating community-wide spread of the novel virus, they're classified as being at high risk of exposure. Medical personnel have been screening, monitoring, and evaluating these folks every step of the way, including before takeoff, during the flight, and following arrival. This includes checking temperature and observing for respiratory symptoms. Medical screening will continue for the remainder of their quarantine, and throughout their quarantine, we will be following CDC guidance for infection control. Anyone showing signs of illness during the quarantine period will be transported to a nearby medical facility for isolation, evaluation, and care as needed. We know this situation may be concerning to people in the Travis Air Force Base community. Based on our experience with other coronaviruses, we don't believe these people pose a risk to this community because we are taking measures to minimize any exposures. With coronaviruses, person-to-person spread is thought to occur mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza or other respiratory pathogens spread. These droplets can land in the mouths or noses of people who are nearby and possibly be inhaled into the lungs. There may be some spread that happens through close contact or touching a contaminated surface, but it's not thought to be the main way of spread. The public health measures CDC and the federal government are taking, including this quarantine, are science-based. We're taking this action to help protect the health and safety of all Americans. CDC staff have spoken with the evacuees at Travis Air Force Base. We explained to them that CDC, under statutory authority of the HHS Secretary, has issued federal quarantine orders for all 178 passengers. The quarantine will last 14 days from when the plane left Wuhan, China. 14 days is the longest incubation period ever observed with coronaviruses. This legal order is part of our aggressive public health response and will also protect the health of the individuals, as well as their families and their communities.
Sense, but they could hold a key.
First indication that
To me, the lines and squares in this image make little sense, but they could hold a key to developing the world's first coronavirus vaccine. Professor Robin Shattuck and his small team here in West London are in a global race to find an inoculation against the potentially fatal virus. They've had one major breakthrough already. They're nearly at the clinical trial stage. To get here would normally take 2 to 3 years. They've done it in 14 days.
We'll have it in animal models by the beginning of next week. So we've kind of short-tracked that part. The next phase will be to move that from early animal testing into first-in-human studies. And we think with adequate funding, we can do that in a period of a few months.